shifted to 1 p.m. because of certain issues. So right now, I'm going to quickly start the meeting. We don't have time to wait. This is 10 minutes in already. We have some other guests who will be joining us soon. They're just telling me that they will be with us in about 5 minutes. So we'll just start all the same. So yes. So Dr. Olodamilare Akinbade is a passionate nurse researcher and a certified global nurse consultant with extensive experience in healthcare innovation and education, with a dedication to improving patient outcomes and advancing the nursing profession. Dr. Akinbade has worked across various healthcare settings, leading initiatives that integrate technology into nursing practice. Dr. Akinbade holds a doctorate in nursing and has specialized in digital health, telehealth, and evidence-based practices. As a founder of Nursoscope Inc., he aims to bridge the gap between nursing practice and technology, providing solutions that empower healthcare professionals and enhance community health. With a strong commitment to mentorship and professional development, Dr. Akinbade actively supports the growth of nursing professionals through training programs, workshops, and personalized guidance. His research interests focus on the intersection of nursing, health technology, and community health, driving forward initiatives that address health disparities and promote wellness. Yeah, so that's a brief introduction of our guests today. A very important figure when it comes to nursing research innovation in Africa, not just Nigeria, in Africa. And like I fondly call him Prof. He's one of my most favorite scholars when it comes to healthcare and research, and he has been a friend, a mentor, a supporter all through the years. We have been together for a very long time now. The story dates back, back when he was still in Nigeria, working with Nursing and Midwifery Council. Yeah, and I was in one of the hospitals there. Yeah, so he's a very old friend, a very old acquaintance, and a very, how would I put it, a very, very experienced and rich person when it comes to research in nursing. Yeah, so I welcome Dr. Olodamilare. Thank you so much, sir, for joining us today. We really appreciate your presence, and we believe that we are going to learn a lot from you as you tell us about the critical role of research, innovation, and education in advancing healthcare delivery and practice in Africa. It's going to be a discussion class where we discuss and ensure that we can cover a lot so that others who would want to listen later can join in the discussion and also learn a thing or two. Yeah, so briefly now, in the next 45 minutes to an hour, I'm going to allow Dr. Olodamilare share his insight quickly, because I like very quick meetings. I don't like to waste time, to share his insight about the role of education, research and innovation in advancing healthcare delivery and practice in Africa. So thank you so much, sir. You're welcome. You can share your screen and take it from there.
Okay, thank you very much. Can you hear me?
Yes, I can hear you.
Okay. I'm going to try to share. I'm not used to
Google Meet, right?
Google Meet, but I should find my way around it. Let me know when you say something that looks like my screen.
We can see your screen. I can see your screen.
I'll see. Okay. I'm trying to bring up the PowerPoint. Okay, just give me a moment. So thank you very much, sir, for the glowing welcome and wonderful remarks. It's my very pleasure to be here. Good afternoon, everyone. Good morning, good evening from anywhere you are connecting from. Thank you so much, everyone, for being part of this. I'm not sure, can you see anything that looks like my slides?
Yes, I can. I can see your slides.
I can see my slides. So I'm trying to put it on slideshow. Let me know when it comes on slideshow at your end.
Yeah.
Is it on slideshow already?
Yes.
Okay, great. Well, thank you. I'm always presenting on Zoom. Google Meet is a bit. Um, I'm not really familiar with how it works. Okay. Once again, thank you so much. As Mr. Angela said, our relationship has dated a very long time, and there is no way I will write my story as far as research is concerned, as far as my journey in nursing is concerned, that I will not um, highlight the critical role he has played. Yeah, and at a very crucial time of my life when I was locating to Abuja, it was very challenging. The first 3, 4, 5 months was really challenging, right? And it was there to support. And yeah, we worked together at INR and we have been collaborating ever since. Thank you so much for inviting me. Thank you so much for the great work you are doing. Yeah, I value it so much. I value it a lot, a whole lot, a whole lot. So we are doing so much, and you know, you are one of the innovators that I'm really proud of what you are doing, and I know it can only get better. I also want to acknowledge everyone present. Thank you so much for making the time to attend this meeting. And of course, my mentee who is here also, Gloria Lau. Thank you so much. She assisted me in designing the slides. This slide is her work. I just put some touches to it. And here we've been working together for a while too. And she has been a very huge support. Thank you, Gloria. Okay, so the critical role of education, research, and innovation in advancing healthcare delivery and practice in Africa. This is the table of contents. Healthcare delivery relates to the processes involved in administering health promotion as well as preventive, diagnostic, therapeutic, or rehabilitative services. That's a brief definition of healthcare delivery. And the majority of African countries are unable to meet the basic requirements for good health systems. During my PhD in Hong Kong, I was part of a program, the GNLI program called the Global Nursing Leadership Institute of the International Council of Nurses. So during that program, we had to write our country profiles, write some things about our country, and then I got into searching some things about Nigeria. I got to understand from my search that Nigeria's healthcare system is one of the worst in the world, and it's is not peculiar to Nigeria alone, but many African countries. Yeah, they are faced with various global challenges and opportunities to improve healthcare delivery. Many African countries are unable to meet the basic requirements for good health systems. And I've been privileged to live in various continents, lived in Africa, lived in Asia, and currently living in North America. And from my analysis of the healthcare systems, I understand we have a whole long way to go as far as healthcare is concerned in Africa. And today's discussion will give us insight into the things we can do to be able to push healthcare delivery and practice in Africa to the next level. There are 6 pillars of healthcare. One of them is governance and leadership, information, financing, service delivery, health workforce, medicines and technologies. These are 6 major pillars of healthcare delivery. And if we are going to improve healthcare delivery in Africa, we must pay very close attention to many of these areas. There are quite a number of challenges that we face, including underfunding, workforce shortages, and a growing burden of non-communicable diseases. The shortage is massive. I remember 2021, 2022. During that same program, I talked about GNLI. I was to do a research project during that program, and it was conducted in Lagos, Nigeria. We are looking at a needs assessment to be able to design a kind of research club or research organization, or how do I put it now? Like a research unit or a research center, Yeah, that's the word, the Research Center for Nursing in Lagos State. So we're trying to gather the things we need and conduct surveys and things like that. And one of the discoveries we made when we interviewed nurses across various things is that research is the last thing on their minds. One of them said, I did that interview, one of the major leaders, maybe a CN, of course, maybe ADNS, Assistant Director of Nursing Services, a very big figure at Louvre. She told us that research is the last thing on their minds. We are in crisis. And that was the title of a paper we published in Nursing Open, talking about the crisis that is actually inherent in healthcare delivery in the healthcare system in Nigeria. And I know that's the same thing across various countries in Africa. I've been able to interact widely with various nurses from Africa, healthcare system from various countries, and I know that many countries are actually grappling with these concerns. Education, research, and innovation play vital roles in the advancement of healthcare delivery and services, and this in turn has great impact on these pillars of healthcare delivery. The state of healthcare delivery and services in Africa is poor and still far behind the rest of the world. Like I mentioned earlier, Africa's healthcare systems are at a critical juncture, facing multifaceted challenges that require comprehensive and collaborative solutions. In this webinar, we are going to be discussing how education strengthens the healthcare workforce, how innovation bridges gaps in service delivery, and how research informs evidence-based policies and interventions. So let's talk briefly about education in healthcare advancement. Education is the foundation upon which healthcare is built. Without it, we cannot provide high quality care. I'm also privileged to study in various parts of the world. I'm currently doing my postdoctoral research fellowship at the Faculty of Nursing, University of Alberta, funded by Alberta Innovates. And one of the things I've come to realize when studying educational systems of various countries around the world is that any country that does not pay very close attention to the educational system of its country will find it difficult to have a very good healthcare system. Right. Yeah. And that's one of the major challenges we are passing through in Africa currently. The educational system has to improve. Kudos to what we are doing in a country, for example, like Nigeria. Yeah, we're doing a lot. I did 2 degrees, like I'm going to mention, in Nigeria. My first degree, my master's, were in Nigeria, and Nigeria provided a very great foundation upon which I'm building something global on currently. However, something more still needs to be done as far as the educational system in Nigeria, Africa is concerned. Healthcare education is a fundamental aspect of developing competent and skilled healthcare professionals, which leads to overall strength and effectiveness of the healthcare system. Education is vital in advancing healthcare delivery and practices because it has a key role in promoting health, safety, and well-being. So what are the roles of education in healthcare advancements? It enhances clinical competence, addresses public health challenges, fosters interdisciplinary collaboration, promotes lifelong learning and professional development, encourages adaptation to technological advancements, promotes patient safety, and the list goes on. The list goes on. As I said earlier on, education is the bedrock of healthcare advancement. So like I said earlier on, this is my educational path. I did my first degree at LAUTECH Ogbomoso, graduated 2011, moved to University of Ibadan for my master's in 2015, completed around 2017, early 2017. I moved to Chinese University of Hong Kong in 2020 for my PhD. And one of the things I realized during my educational pathway is that educational system of Nigeria, of Africa, needs to be strengthened. For example, I noticed that while I was in Nigeria, there are some things I learned only by theory. I learned them theoretically alone. I didn't have some tools to be able to put into practice the things I was learning, especially in the field of research. For example, during the first year of my PhD, I conducted a systematic review for understanding the effectiveness of digital health interventions in in addressing psychological issues of women with breast cancer receiving chemotherapy. And during this study, I had the opportunity to search like 14 databases. Now, these 14 databases, maybe just one of them is free, right? And that's PubMed. Others are very expensive, and many of our institutions need to subscribe to this database. Before I left Nigeria in 2020, I doubt if there was maybe any institution that has access to these databases. Maybe some are now trying to get access, because it's very expensive. Actually, it's very expensive, and we won't blame the universities that do not have access to these facilities. The government is not funding these things because these things are very expensive. I was in our university some weeks ago. I received an email talking about the funding that was received. When I saw that money, hundreds of millions of dollars that is being pumped into the educational system. And I was wondering, you guys have everything going well, and you're still pumping seriously. And same thing in Hong Kong, a lot of funding opportunities. Now, anybody that has an admission to do PhD in Hong Kong is technically free. So they call some universities RGC universities. RGC universities, they are universities that are funded by the government for research. So they want to bring the best talents all around the world to come to Hong Kong to come and do research. And the interesting thing is that they are not just doing that to improve, because as we do research, we're going to improve their healthcare system, we're going to improve their country, you bring your talent, but then they're not even really interested in you staying to develop their country. They have so much developed that they also want to develop other parts of the world. So they encourage you, after you finish your PhD, go back to your country, go back to different places and go and impact those nations with what you have learned from Hong Kong. Yeah, and many nationalities, that's one of the countries I made till date. Yeah, I met a lot of people currently in Canada, but in Hong Kong, I met a lot of people from various countries, from various Asian countries, African countries, built a very large network for research and collaboration. So this is a classical example of how a country can fund its educational system. When that system is funded, you can attract the best talents. I had from history. There was a time in Nigeria that many people were coming from various parts of the world to come and study in Nigeria. The educational system was that strong. And I think there's no rocket science behind this. I was discussing with Professor Priska Adejumo some weeks ago, and she was telling me that currently, even in the University of Ibadan Faculty of Nursing, currently they're having some scholars, Nigerians though, from abroad, that are now signifying interest to come to University of Ibadan to come and do maybe a PhD program, a master's program, and things like that. It was like that many years. It was not strange. In fact, it was really strange to me, really, but it was not strange back then because the education system was really top notch. There's a requirement to funding. There's a cap to funding, a minimum requirement of the percentage of the revenue that should go into funding education. When that quota is not met, there is a huge problem, right? So funding educational system is very, very important. We see the ripple effect in many areas of the economy. It's going to affect health, it's going to affect finance, it's going to affect education. Indeed, is the bedrock of everything. So challenges, I've mentioned some of them: limited access to quality education, inadequate infrastructure. During my PhD, I did a side research where I examined the educational needs and experiences of Nigerian postgraduate nursing students during the COVID-19 pandemic. This study, you can Google it online. It's online, and that study gave us a lot of insights. Of course, some of those things I already know, but I gave us a lived experience from the perspectives of the postgraduate nursing students that were actually passing through those things, and they were telling us how they struggled during the COVID-19 pandemic. And those struggles had been there before anyway, but they were actually amplified by the COVID-19 pandemic. That was the time that many of them, they had challenges with accessing their supervisors. At that time, some of those schools were not online. We are not receiving lectures online. Though things are changing now, they are changing, but then many things still needs to be done. Currently, I lecture virtually. I lecture part-time at Faculty of Nursing, Chrysler University in Nigeria. I started 2021 during my PhD till date. So I teach online through Zoom, right? But then the technology is getting better. At least the university gives students free Wi-Fi and things like that. But I still beg to say that there are still many things that still needs to be done in institutions in Nigeria. Not only Chrysler. I've also been opportunity to deliver guest lectures for another university in Nigeria for the postgraduate, masters, and PhD students. Right? Yeah, and I noticed that many of these institutions too, they have not built a very solid infrastructure. Let me give you an example. When you enter a classroom in Hong Kong, for example, as you are entering, the lights come on. You don't need to go on the lights, it's automatic. We enter a sensor based. You enter, the lights come on. When the lights come on, there is a projector, there is the the screen, very big screen, the projector, there is the speaker, there is a speaker, there is the computer already there. You don't need to students sometimes when I when I started teaching online in Nigeria, sometimes the students will say, oh, this laptop is having fault, this laptop is no, the computer is already there, right? The internet, the university has internet, just go there, every lecturer has their password, just enter your password, connect, start teaching, and when you are done, there is a microphone, everything is there, and there is also the technology that you can connect to Zoom, so that when I'm speaking from anywhere I am speaking in the class in Nigeria, for example, a speaker should be beaming out the sounds. But no, we don't have it in many institutions. Many people still need to connect to their phone. Imagine 100 people in a class, all of them connecting to their devices. It's going to be rowdy. A lot of things that still needs to be done to be able to fine tune the digital spaces for delivering education as far as Nigerian system is concerned. Outdated curriculum and teaching methods, shortage of qualified educators. Many people actually live in the country. The Japa syndrome has affected universities, affected schools of nursing, and resistance to change and innovation. All these are challenges facing healthcare education. Let's talk about research in healthcare advancement. Healthcare research is fundamental to improving patient outcomes, enhancing healthcare delivery, and shaping policies that promote health. Research is significantly known for its role in evidence-based practice. Research in healthcare delivery focuses on improving how healthcare is organized, financed, and implemented. And this is an area I'm very, very passionate about. Anybody that knows me knows that I love research. I was speaking with a mentor yesterday. By the way, I started a company 3 to 4 weeks ago, around 1 month old now, Nurses Cove Incorporated. So we are into mentorship for healthcare professionals and consulting. It's a consulting firm actually, on research, grant writing, career advancement, and various things. So one of my mentors and tech in nursing. So she was interested in tech in nursing. So we had our first meeting yesterday, right? And I was telling her about the need to have a digital presence. And I'm also going to tell you that now. I know many of you are doing so well in that. At least I know some very familiar faces here I've seen online. Building a digital presence is very important. Many of you have heard of the opportunities, funding, grants, opportunities I've gotten, right? Many times before they give you any money, before they give you anything, they want to search you out. They'll put your name on Google. What comes out? I remember during my master's program, Professor Chris Kadejumo give us an assignment. I've said it many times when I'm presenting. Type your name on Google. Anything that comes out, print it out and submit tomorrow. That's 10 marks. I got 1.5 over 10. The highest mark was 2. And which was using that to teach us the importance of digital presence. So I told her now that, can you put nursing research Nigeria? You will find my name. Of course, you find INR, the organization we built, and then you will find my name. You won't search too far before you see my name, right? As far as nursing research in Nigeria is concerned. Yes. So that's a classical example of a digital presence, you building your digital footprints, then they can know that this is, so if they are looking for anybody that they want to engage, as far as research issues is concerned in Nigeria, in Africa, you want to talk to me about that. So there must be a field in nursing. I know there are many nurses here, right? Healthcare professionals, no matter your field, there must be a field in your field. Permit me, that when they won't need to go far, they won't need to explore too wide before they find you. As far as that field is, you want to dominate that space. You want to be one of the first 10 people that will come to the minds of people when they hear about that field. So for me, it's research. I'm highly passionate about this. So why do we need healthcare research? It provides foundation for evidence-based practices. It provides information about disease trends and risk factors, provides public health policy, informed decisions, improves quality of care, helps evaluate and refine treatment protocols, and drives healthcare innovation and technological advancements. When you ponder about these various roles of healthcare research, you notice that it's very, very important. In fact, without research, the healthcare system will not move forward. And any profession that is not doing research is going to fizzle out eventually, because many of the things that we are doing must be based on evidence, and evidence-based practice is actually something that is the in thing now. So what's EBP? EBP is a kind of practice that utilizes the best form of evidence, and that evidence can be gotten from research. And you want to consider some other factors like patient preferences, you want to consider cost and other things like that in making the healthcare decision. So research plays a very important role in this. By that we can birth innovations. I talked about why am I in Canada currently after my PhD. It was a research funding that brought me abroad. I always tell people research will take you around the world. I've experienced that many times. My first experience living in Nigeria was in 2017. I went for a conference in Ghana, Accra, very close to Nigeria, but then that was my first experience. It was research, actually. I went to present my master's research in that conference, and 2023 years after, I went through research to Hong Kong, and I'm currently through research in Canada through research, and I've been to Japan also through research. You can, if I'm tired of traveling now, maybe that's one reason I've not been traveling much again. The older you go, I'm getting older now. I want to sit down in one place, but really, you can explore as many countries as you want. So get grants, go and present. If you like traveling, research is something that will take you around the world, and of course, it improves our healthcare system. They are able to provide evidence. Gone are the days when you make decisions just based on your knowledge or based on your experience. We are talking evidence these days. In the area of antimicrobial infection, research has influenced the development of new treatment guidelines, guiding clinicians in choosing the most effective antibiotics while lowering resistance rates. Also, the development of COVID-19 vaccine was made possible through rigorous research made on mRNA, and that provided an effective response to the pandemic. Yeah, so research is important to make decisions, and there are various kinds of research that we conduct. One of them is what I did during my PhD. During my PhD, I developed a mobile application to provide psychoeducational support for Nigerian women with breast cancer receiving chemotherapy. And this research was groundbreaking. It was a randomized control trial, right? And there are other kinds of research like surveys, qualitative studies, systematic reviews, and other kinds of studies like that. When we conduct research, we are able to influence policies and we can advance our healthcare system. And there are many, and one of the purposes why we must also do research is to attract funding. Yeah, I thought so. It's like a cycle. I talked the other time about the fact that we need funding for our educational systems, right? If we do not have research, so it's a cycle. Research will bring funding, funding will bring research, if that makes sense, right? Yeah, research will bring funding, funding is going to culminate in research, right? So when you want to write a grant, for example, you need evidence. Some of the things that can give you much leeway to getting funding is when they know that you have done something in this area before. For example, it was until I got to Canada that I knew the value of the funding I got for my postdoc. It's not easy actually. It's not easy to get that funding, even for those that are in Canada. That they won't need visa, apply for visa. It's not that straightforward. It's actually very, very, very competitive, very demanding and all, right? But then I got it. And one of the reasons why I got it was because I had done a kind of research in that area, digital health. And I told them, wrote a very nice proposal. Anyway, I was planning to continue that research in Alberta. I told them how it can influence the Canadian healthcare system. And of course, why not? They brought me on board. So if you want to also contribute to your quota to healthcare system, to getting more money to be able to fund our educational systems. In fact, when we have data that, these things are happening in the educational sector, we can get funds. And one interesting thing about funding is that there are many countries, many of the developed nations, they want to give money to Africans. They want to give money to Nigerians. Yeah, they want to fund healthcare. Not giving money to them, like dashing them like that to go and buy a car or go and build houses. No, they want to fund research in these institutions, in these countries. But many people do not have the skills, and that's one of my passion as an healthcare professional. I want to equip nurses. I want to equip healthcare professionals with the skills. I've interacted widely on scholarly issues with healthcare professionals. I can say categorically that many healthcare professionals do not have the requisite skills needed to be able to conduct good research. I mean, medical doctors, nurses, pharmacists, and a host of others, right? So we need to build the capacity of these scholars to be able to do very good research and attract funding. Professor Adejumo was telling me, she's my mentor, she was telling me I think it was during our conversation. Of course, she always mentions that many years ago, and one of the things that attracted me to her was how she was able to get a lot of funding. Oh, that woman is heavily funded. She has been funded heavily to do research for doctors, for nurses, healthcare professionals in Nigeria, in Africa. She's taught many nations of the world on the wings of. She's old, but she's not tired. Well, not so old, but then she loves to travel. Last week, so she was still in Paris. I'm not sure if she's back to Nigeria. Yeah, So the funding she got at some point, when I think I was doing, maybe that was many years ago, actually, maybe 10, 15 years ago. It's been very long. She got that fund, and because of that fund, she was able to buy I think, is it minus something freezer, -10 or minus, very good freezer for immunization, very, very big. And they shipped it all the way from the West, shipped it down to Nigeria, and then the question is, where we are going to put this? If we put it in the back of nothing in UI, there will be no light. So she just has to negotiate some doctors that let's see how we can put this very big freezer from a very big organization in the US. Let's find a way to put it in your clinic where we can be sure that there'll be light to power it and things like that. That's an example of how we can use funding to attract research. To attract funding and attract infrastructural development in our educational systems. Please let me know when I have 15 or 10 minutes to go, so I don't take too much time. Digital health solutions, electronic health records, and remote patient monitoring, all these things can actually happen through research, right? Like I said, my PhD research was in those realms. So research studies on universal health coverage have greatly influenced the global health sector, making sure that there are more equitable access to healthcare services at all levels. Key areas of research needed in African healthcare services: infectious diseases, health system strengthening, healthcare technology and innovation, non-communicable diseases, maternal and child health, healthcare access, any of those areas and more that you are exploring, you are good to go. I always tell people it's important as young ones. I know there are many young, excuse me, I know there are many young healthcare professionals in this space today. I want to encourage you from your undergraduate days to your early postgraduate days, make sure you have a research interest, and continue building on that. Don't deviate if possible. Don't deviate, because sometimes you might have to deviate because of some factors like funding. For example, I did different kinds of research in my undergraduate, in my master's, and my PhD. If I know what I know today, I won't go different routes. Of course, I didn't know better that time, right? But for my PhD and my postdoc, I'm continuing on that trajectory of digital health and oncology nursing, right? So you need to find that particular niche, that research interest, and continue digging deep and deep in those areas. So this chronicles my research journey from LAUTECH, where I got exposed to the fundamentals of research, the University of Ibadan for my master's, Chinese University of Hong Kong, and during my master's at University of Ibadan, we built this organization, INR. Many people know about it. I was in a meeting in Canada going to a month now, if I'm not mistaken, and I met a Nigerian. He's not an healthcare professional at all, actually. He's not an healthcare professional. So I was telling him we are trying to do some collaboration on some projects here, and it was like trying to tell him what I've done, meeting me for the first time, and these, and very nice day, Nigeria. I know about it. I know about it. You guys are doing a lot and things like that, and that speaks to. I can also read more about it for those who do not know. That organization was founded by Fellowship of Christian Nurses, a non-governmental professional organization in Nigeria that is committed to supporting nurses, building nurses, training nurses to be better nurses, caring for the spirit, soul, and body. And it was through that organization that we started INR. I handed over as the CEO of the organization just some months back, September 2024. And moving to University of Alberta, Canada, where I am currently, I'm continuing that research piece. And some weeks ago, like I mentioned, I started my consulting firm. By the way, I was certified as a global nurse consultant in 2022. And since that time, I'd been putting some, of course, I'd always consulted for various people, organizations, individuals that are interested in research and related matters. But this is the first organized approach to, to concretizing all I've been doing in that space under a firm. Okay, so that's my research journey. For those who want to do research, you are welcome. The space is so big to contain all of us, as many people as are interested. So challenges facing healthcare research, major ones, really limited funding. I mentioned that earlier on, shortage of trained researchers, poor data collection capabilities, lack of access to necessary technology, and inadequate infrastructure. Research is the backbone of healthcare advancement. Without it, we would not have the treatments and therapies we have today. So let's talk about innovation in healthcare advancement. Innovation, I think that's the last part actually of my presentation. Innovation in healthcare advancement. Innovation can be defined as the intentional introduction and application within a group, organization of ideas, processes, products, or procedures new to the relevant units of adoption designed to significantly benefit the individual, the group, or wider society. In short form, innovation is birthing something new. Birthing something new. I'm an innovator actually, and I'm really passionate about birthing new technologies, birthing new things. And I want to encourage us as professionals in our different spaces. Think as a researcher. When you think as a researcher, you always want to challenge the status quo. Why are we doing it like this? Why must it be done like this? How can we improve the system? What else can we do to change the narrative? And that's innovation. In any space at all that you have, there will always be a better way of doing things. And that in itself is innovation. It involves application of new technologies, processes, policies, and models of care to enhance the quality, accessibility, and affordability of healthcare services. It is a transformative force that is crucial to the advancement of healthcare services in African countries. So innovation in healthcare, there are quite a number of them, things that we can do. One of them is technological innovations. We have the process innovation, policy and organizational innovation, pharmaceutical and therapeutic innovation in various fields. The first one is what I'm passionate about, technological innovations, and have done research on this area. I'm still doing research in this area. And I'm so passionate about it. But it's not only limited to tech. We also have various areas in healthcare. Some are policy related, some are process related, and some deals with some deals with drugs too. So let's talk about the diffusion of healthcare innovation, diffusion of healthcare innovation. This theory was propounded by Everett Rogers in 1962. The theory explains how new ideas, products, or services spread through a population, and the shift from the use of paper-based systems to electronic medical record is an example of diffusion of innovation in healthcare. So diffusion refers to how we develop the process from when the innovation is developed to when people accept it. And it's very crucial to take this into consideration when we are designing things as innovators. I talked about the fact I wanted to start a research center in Lagos State some years back, but we first went ahead to do a needs assessment. That in itself is research, right? And during my PhD too, I was trying to develop a mobile application for providing psychoeducational support for Nigerian women with breast cancer receiving chemotherapy. But the first thing was to gather the evidence. You want to know, oh, okay, this intervention I want to develop, does it actually make sense? Is there any evidence that supports the development of such interventions, right? And then after you have gotten that preliminary evidence, you also want to ask questions. So we did a qualitative study among Nigerian women with breast cancer, asking them various questions. These studies are published online for those who are interested in reading them. Right. We asked them questions around, oh, okay, do you think mobile phones are needed? Do you think we can provide this support? What supports do you need actually? Do you think through mobile phones we will be able to render this support for you? Do you think nurses can be consultants to you during your care, to be able to ask them questions, call them, reach out to them via the mobile app and things like that? So we needed that evidence before we moved to developing the intervention, because it's something to develop an intervention. It's another thing for people to use it. My training as a community health nursing specialist, I did my master's in community health nursing, by the way. It prepares me for this role actually, because in community health nursing, before you launch an innovation, you want to consider the people that are going to receive those innovations. Key elements that influences innovation: the innovation itself, the idea perceived new, the adopters, the people that are going to use it, communication channels, the means by which the information is shared, the time, and then social system. And this is the Rogers diffusion of innovation theory, talking about how innovation is received. And it's important for innovators, when we are designing innovations, to put all these things into consideration, because when you release an innovation out for people to use, we have the early adopters. These early adopters, they jump at it. Oh, something is new, and jump at it. Some people are still checking out, still skeptical, right? And these are late majority, and of course the laggards, those ones, they are even resistant, as it were. They don't want any change at all. So in an organization, we have all these people, and the early adopters are a very little minority of the whole population. So when you release an innovation and then people are not accepting it, calm down. Don't kill yourself, because it's actually very difficult to even bat an innovation to start with, and then you now bat and people are not using it. You are confused and you are feeling bad. No, you should not. It takes time. And then there are many things, like we observed here, elements that you need to now sit down and technically, in fact, before you even launch the innovation, you need to sit down critically to begin to look at these things. Oh, so is this thing even needed to start with? Or will they accept it? How do we drive these things out? How do we send the signals out? What are the things that we are going to use to be able to reach out to the community that is going to use these things, right? So characteristics that influences adoption of innovation: the compatibility, trialability, relative advantage, observability, simplicity or complexity. Yeah, these are very important characteristics. Compatibility. Sometimes we develop an innovation and it's just as variance with what we are doing. There's no way we can integrate it. It's not compatible with the system. It's not compatible, right, with the system. Trialability. So when you are developing an intervention, so there's also the place of trying it out. I talked about the research I did during my PhD, the randomized control trial. It's an It's an attempt to be able to test what we are developing among a very small population before we now reel it out. We talk about evidence-based, right? It must be evidence-based. So there must be an evidence that suggests that if we use these things with our patients, they are good. They won't cause problem and things like that. The relative advantage. People must be able to perceive these things as advantageous. There are many innovations that stop at the point of people receiving it because they do not perceive that it is needed. And even sometimes when people perceive that something is needed, before they use it, it takes time. What if they do not perceive it as needed? Then it takes more time for them to adopt it. So you want to be sure that you have done due diligence. And many times innovators fail at this point. They fail at this point. In fact, I think it's important for us to note that innovation, having an innovative team, you need a lot of people on board. Mr. Ella is going to bear witness to this. There are many people that need to bring their various competencies on board before any innovation is going to fly. People, we need product designers, people that are going to sit down with the product. We need graphic designers, and graphic designers, they are not sometimes they're not the web developers. So you need those graphic designers that are able to develop very catchy things. It's a technical world. Actually, it's very technical. If you have developed a very good intervention, and then the website is so poor, the UI UX is so poor, the design is so poor, the graphics is so poor, as beautiful as the services that you are rendering, people are not going to come. Because when people see your website, they are already put off. When people see the flyers that are coming from you, it's not professional, right? So you need those ones. And you need people that are going to be able to, sell those things to the community. You need people that can talk in a very convincing way, reel out videos, do a lot of, and those things are very expensive, really. Before you can release a very good video now, that is very good for YouTube, for social media, it costs a lot of money and things like that. So you must be able to consider all these things before you launch out your innovation. Observability, you must be able to observe it. So let's say, checking it over time. Let's monitor it over time, because when you release an innovation, for example, for the very first time, there is a possibility of it having hiccups. I worked, like Mr. Ila said, at some point with Nursing and Midwifery Council of Nigeria, and when I worked on the IT department, indexing actually, but then I was working online on the computer, on the portal of Nursing and Midwifery Council of Nigeria. No. Oh no, there are a lot of it. It's a lot of work actually. A lot of work has been done. There are many people going back and forth. Before anything is deployed, we test it, test it and check through a lot of things, support and correct this. Send mails, correct that. One school is calling from this, we have not gotten this, and that school is calling from that place, we have not gotten this. Before you release an innovation, you want to observe it. Oh, okay, and as you are observing, you are updating it. Oh, we are getting feedback. Oh, this thing needs to be done. This thing needs to be improved. Another thing is simplicity. Simplicity is very, very crucial in your intervention. You don't want to make it too complex. In fact, one of the things that drives innovations that many people receive it is when it's very simple to use. People have enough problems in their lives. Are we together? People have enough challenges. They are battling with a lot of things. You don't want to add your own innovation to their problem. You must make it very simple, easy to navigate, and things like that. I know some innovators have some things to pick from that. Okay, as I'm running off, rules of innovation in healthcare improves patient care outcomes, access to healthcare is increased, healthcare efficiency is enhanced, and healthcare cost is reduced. Challenges to healthcare innovation: high implementation, it costs money, we need money, resistance to change, some people don't just want to change, limited access to technology, regulatory, and ethical concerns. In conclusion, maybe if I move into conclusion, let me just talk briefly about some of the things. I've mentioned them during my presentation, some of the things we can do to be able to access some of these opportunities. I believe so much in collaboration. So I want to encourage people that are here, reach out. It's important for you to reach out. So there are some skills that I need that I don't have. For example, I talked about how it's the power of collaboration that made me able to deliver this presentation. I've been very busy. I mean, very, very busy. I have a lot to do, right? So if not for collaboration, I might not be able to do this, right? And of course, before someone can, I mean, you can say the slides are excellent quality. It has taken time, time to work together with we've been working for some time to be able to achieve this kind of excellence, right? And do something that is like what I'm going to do. And that's what I also do for Professor Adejimo. Over the years, she give me, oh, do this for me, do this for me, do it for her, and she just pick it and then go and present and things like that, collaboration. So there's some things that we have here that you need in Nigeria. You need to reach out to those that are there, that are in various parts of the world. I have a lot of network with healthcare professionals across various countries. We need each other. You're right. We need ourselves. So you need to be able to reach out and get right fund application, grants, opportunities. There are many of them. Train yourself, reach out for people that know about these things, let them train you in how to go about it. Build your research competencies, very important. Leverage social media, make sure your digital presence is very good, and then publish and make yourself a very a highly claimed an expert, a subject matter expert as far as that field is concerned. In conclusion, in African countries, strengthening the link between education, research, and innovation is crucial in order to address healthcare disparities, enhance service delivery, and improve population health. Education evolves by incorporating research findings and innovations into training programs and practice, which in turn advances healthcare delivery. By investing in education, research and innovation in African countries, healthcare systems can become more resilient, efficient, and capable of delivering quality care. These are my references. Thank you very much for listening.
Yeah, thank you so much, Doctor. I was, as usual, when Prof presents, his style of presentations are always very captivating because they have a way of incorporating real life stories, events, into theory, right? Yeah, so he won't just talk about theory and talk about what others have said or are doing, but he has a way of also telling people, has a way of also educating, by bringing his own experiences. You see, he has told us about his research career from his early days in Nigeria all the way to where he is now. And what I've observed as someone in the field of communication is that when you communicate with stories, people tend to understand you better, and people tend to connect with whatever you are saying. It's easier, unlike when you're just being abstract. In marketing, stories actually sell more than just theory. So he has a way of connecting with his audience with stories, which is very, very important. Yeah. So if there's anybody that has a question, you can type your question in the comment box quickly. Now we have spent an hour already, and I like to be very fast when it comes to meetings, especially virtual meetings, because the idea of our webinars are to actually just have the meeting virtually, and then later on we can now share them with our communities, so that people can also read them, listen to them, and also benefit from them. Yeah. So that is it. So if you have any questions, before I ask my own questions, I have just 2 questions here. If you have any questions you want to ask Doctor, please let us send them to the comment box, or you can unmute and speak. If you have any questions, quickly now. Any questions? Anybody has any question before we move ahead? Okay, so if you don't have any question, I have a question for Dr. Esa. So the first question I have there is, now, how can we make healthcare professionals in Africa get interested in healthcare research? In healthcare research. So here's how can we make healthcare professionals in Africa, nurses, doctors, pharmacists, medical laboratory scientists, health information experts, whatever, how can we make them in Africa, specifically in Africa, how can we make them get more interested in healthcare research?
Thank you so much, sir, for that insightful question. Very good question, and insightful. How do we encourage healthcare professionals to be passionate about research? Um, I think the foundation is crucial. The foundation is very important. We need to start from when these students are learning, teaching students research methodologies. I teach research currently at Faculty of Nursing, Coastal University, Abeokuta, Nigeria. I teach virtually, and I've also been committed to teaching research at INR over time. Right. And one of the things I realized about research is that many people do not like it. Many shy away from it because of the styles by which people have been lecturers teach. Some, yeah, and it's also very abstract. So before you can make something very abstract, very relatable, so the teachers need to do a lot of work to break down research concepts into simple things, easier concepts that people can actually assimilate. And one other thing that I also found that works very well is the changed mindset of people about research. Many people believe that they can't know it. That research is too difficult, we cannot know it. So we need to do a lot. And INR has done a lot actually. That's the Institute of Nursing Research Nigeria. We have done a lot to be able to as far as nurses are concerned, change their mindsets about research, and things have actually changed. We have seen improvements over the years. Many people now embracing research, but many people now getting more comfortable, as with research. So a lot of advocacy needs to come in, and people that are in the research space, we need to do more in terms of projecting what we are doing, because it's many researchers are just, their heads are buried in their research, in their laboratories. Sometimes can be in the lab for hours, 12 hours. You are there, you can be on a computer. For those of us that do research online, we those in dry labs, we call it dry labs, that I do not need to mix chemicals, unlike the wet labs where we mix chemicals and all. Those in dry labs can be on a computer for many hours. You are there. So many researchers don't have a social media presence. They do not. So they have done a lot. When you enter their research gates, enter their Google Scholar, you see a lot of citations, you see a lot. But then there's a disconnect between everything that people have done and the this a disconnect between what people have done and the results, that we are seeing outside. Because when people see those results, they're actually very motivated. And I have done a lot, maybe not too much, but a lot in projecting some of those evidence I'm getting and then sharing it. And the government also needs to support. Many people wants to do very good research, but the money is not there. The money is not there. I've talked about how I was able to access funds from Hong Kong, access funds from Canada, where I'm currently, as far as project research is concerned. It is the government of these places that make these things easier. Our government in Nigeria needs to, push funding out for research. That will also help many people to get committed to it. I'm not sure if I answered the question, sir.
Yes, thank you so much, Prof. Yeah, so that was very insightful. Yeah, so Dr. Raphael Akambe is here. Dr. Raphael Akambe he's how will I call him? He's a mentor too. So when it comes to healthcare data, he's the right person to go to. Yeah, he's a senior healthcare data professional in Lagos State, and he has always been a part of our meetings right from the start, from CareCo to Care City, and he's here now. I would like to give him the opportunity to speak. So, Dr. Raphael, please go ahead, sir.
Thank you very much. I really appreciate it. Can you hear me, please?
Yes, we can.
Yes.
Okay. Thank you so much, Doctor. It's a pleasure, meeting you again here on this platform. And I'm sorry I came very late. I've been having a series of meetings with some digital health partners, and so we just finished not quite long. That's why I joined. Yeah, from what I met on ground, we're talking about the healthcare research and stuff like that. And we all know that when it comes to healthcare research, it is one of the most expensive research we can think of, even around the globe, because it requires a lot of input of funds to ensure that we get it right. But this area, I just want to ask you, is really not a burden, but for the benefit of those of us that are on this platform, because it's part of the area that we really need to look into. And that is talking about what kind of strategies, do you think can improve healthcare financing and also reduce out-of-pocket expenses that we have in African country now? Did you get me, please?
Of course, I did. I did.
Thank you very much, sir.
Yeah. Oh, thank you so much for that question. It's a very insightful one. So I also have huge concerns regarding financing for healthcare currently in Nigeria and in Africa. From my experience, living in Hong Kong and accessing healthcare system there, and also currently in Canada, looking at how the healthcare system is funded, I noticed that we still have a very long way to go as far as African healthcare system is concerned. Number one, I think we need to start from advocacy for, well, people have been talking about it, but we still need to talk more about it. It starts from the government, doing something proactive about it. Yeah, we can give kudos to some state governments that are doing a lot trying to change the narrative as far as healthcare financing is concerned, but we still need to do much more for healthcare financing. We need more allocation to more allocation from the budget to healthcare. That's one. Two, we also need to get the non-governmental organizations also involved. Now, it's interesting to know that many of these countries that we really look up to, it's not only the government that is doing these things. There are many people in the private sectors that are doing so much as far as funding healthcare system is concerned. I talked about the organization that brought me to Canada currently is called Alberta Innovates. So, and this organization are many in Canada. They are not owned by the government. Many of them are owned, by individuals that come together, and then they're able to, get support from different bodies, and then pull those funds together, and then they can share it and invite people to come and do research with them. That's the private sector too that needs to get involved. And also, I think many of healthcare professionals also needs to build competence, like I mentioned earlier on, in being able to write grants that can bring those funding back to Africa, because there are many. I think I should state categorically that many of the funds that are available globally for healthcare financing, healthcare research, they've not been well utilized in low-income countries and in low and middle-income countries. The money is there, but then they can't just give anybody, right? And they can't give if you don't ask. And you need to know, and there's a way to ask. You can't just write something very floppy and then send it. It won't fly. So all these things are actually connected. We need to build the capacity of our healthcare professionals in writing grants, and it takes time. Another thing is also like affecting it is the fact that many people do not have the time. The lecturers are overburdened. The scholars are now in Canada, in Hong Kong, that are schooled to. I noticed that there's a great distinction between professors that are doing research and lecturers that are teaching. I'm not sure if that makes sense, but here in Nigeria, the same lecturer will teach, the same lecturer will mark, the same lecturer will go about, supervising, go about accrediting schools, go about presenting in different places, and now want to do research. There won't be chance to do research. There won't be. So we need to see how we can have people that all their work is just research. These people are just doing research, and then they are bringing the grants, bringing the money, and then this money can be also used to improve the healthcare system. I'm not sure if I answered your question a bit, sir.
I really appreciate the right way you've approached the questions, and I am very much satisfied, at least considering the fact that you try to do some comparison where you are and Nigeria as a whole. Like you rightly said, there are a lot of funds, but it's not being used for the right purpose, and that is one of the problems that we're having. And you've actually said it all. But I just have another question, just very. I know you are also in the digital health space, and this is one of my expertise. Apart from what Nas Ayla mentioned earlier on, it's digital health is what I sleep with it, I wake up with it. Right now, we have a lot of issues in Nigeria. Okay, so the
Yes.
aspect of digital health, which is one of the major aspects in healthcare system of this
Ian,
dispensation that we are in right now, is one of the major concerns that we're having, particularly in solutions, that is used into the healthcare market in Nigeria. And instead of this to provide more solutions to the healthcare problem, it's bringing more problems to the system. So, as an expert, what do you think that can be done to really ensure that we have a proper platform that we can actually use to make sure that this digitization of healthcare system thrive in our healthcare space in Nigeria? Thank you very much.
Thank you, sir. You were cut off at some point. I guess that was network, so I couldn't get some parts. But I got the last part of the question that you raised about how we can make digital health systems more acceptable. I'm not sure if I had that well. Making it more acceptable, making it where more people or more systems, more organizations can adopt it. Is that what you mean, sir?
What I meant is that I said that digital health is one of the major areas that the world is embracing now.
Yes.
And
Yes.
in Nigeria, we have a lot of platform for digital
Okay.
health. And instead of this, myriads of platforms to be bringing solutions to the healthcare challenges in Nigeria, it is it is producing more problems,
Mm.
to the system. So, as an expert that you are, and as a medical practitioner that you are, what do you think, that can be done in ensuring that, we have a very good platform that can really integrate all these platforms together to provide quality healthcare system in Nigeria? Thank you.
Okay, thank you very much, sir. It's clear now. It was through the network issues that I was not able to get what you meant earlier. So I think the first place we need to start from is from the conceptualization phase of these interventions, right? And then when writing proposals for digital health interventions, I noticed that many proposals are deficient in the piece of how to integrate those interventions in the existing systems. So like you mentioned, we have many of them and many pockets of them rising from different places, but there is no coordination between these various interventions. And many of these interventions are not even evidence-based to start with. Some people can just sit down from one corner and then just develop an app and then just start using it. What's the evidence behind this? Who are those people that are certified that are delivering the information, and things like that. So I think we need to have a system whereby there can be a coordination, maybe through the governmental organizations that can find a system whereby we can coordinate many of these interventions as they are being developed. Let's see how can we integrate them into the existing systems that we have. For example, as a researcher, I'm trying to develop an intervention. One of the problems that we have is people operating in silos such that, I'm a lecturer, a researcher in the university. I just sit in the university and I develop my research. And those in the hospitals also, they feel that we also can do it. They develop the interventions. Those in the commercial space, they're also releasing the apps out. So there is no coordination between all these people, all these organizations that are trying to develop these various interventions. So I think we need to start working together. Before an intervention is developed and it's an healthcare intervention, we need to be able to collaborate with those working in the hospitals. Nurses cannot just develop the interventions alone. And that's the problem we have sometimes. Nurses want to do it alone. Doctors feel they can develop interventions alone without the input of nurses. Pharmacists believe that they can also do it alone, right? We need to work as a team so that we have the nurse on the team, we have the doctor on the team, we have the pharmacist on the team, we have the healthcare educator on the team, we have various people on the team, and then we can work together from the stage of conceptualizing and of course the patient too. Because that's the problem we have many times. The patient is not considered. So we develop interventions and then it is at variance with the needs of our patients who are going to use the intervention. So we want to consider all these things when developing the intervention. And of course, we want to work with the healthcare organizations, the hospitals, the various agencies, and seeing how we can do these things. And of course, the government also has a huge role to play. We want to see how digital health can be a major focus of various governments, because if the government is stepping forward to say, oh, we want to do these things, then they want to bring various people that are working in those places together and seeing how we can use all our competencies to improve the systems that are on ground currently. And the problem we have is that a lot of people are bringing interventions from different angles, and then they are not targeted towards improving what we have currently on board. So I think if we do that and also change the orientation of people, that you can just do these things, or people in the industry, people working in various, and that's one thing I noticed that they are getting right in this country, in this part of the world. All these people are coming together before they fund a project. They want to see how what is the difference between what we want to do and what is already on ground. Before we fund, they want to see, oh, there is something that this thing can change, and what can you even do to improve what we have currently in the system, and not just duplicating efforts and things like that. I'm not sure if I answered the question, sir.
Doctor, in fact, you've really hit the nail. Thank you so much. Really appreciate this. God bless. Thank you.
It's my pleasure, sir. Thank you. Yeah.
Yes, thank you so much, Dr. Raphael. So these kind of discussions are not, we can't finish them in an hour or two. It takes a very long time to really discuss when it comes to things like this, especially healthcare innovation in Africa. And to contribute to what Dr. Olodamilare said, when it comes to healthcare innovation in Africa, now there's a problem of already placed infrastructure in Africa. Now, when you look at telemedicine, for example, telehealth, in developed countries, there's already a system on ground where healthcare is paid for by insurance. It's a very solid insurance system on ground. So when you introduce a new digital intervention like telemedicine, telehealth, people can pay with insurance. So that infrastructure makes it easier for the solutions to scale. When it comes to Nigeria, when you introduce things like telemedicine, telehealth, these services are not even integrated in the existing insurance scheme, and before they can even integrate them, you know it's going to take a very long time. So that is the role of the government. If the government can put certain infrastructural needs in place, it will be much easier for digital health innovations in Africa to actually take off. Another thing again that Prof said, he said something about the approach of innovators. So now, one thing we have discovered is that in healthcare innovation, we have more tech people coming in who don't have any experience in healthcare. You know, they are approaching healthcare innovation as if it's something they do in Silicon Valley, and there isn't just like you are producing another Uber app or Bolt app or whatever. No, healthcare is different. Healthcare is very personal. Healthcare is very innovative. Healthcare needs a lot more research to back up whatever solution you want to inculcate. So what we want to see now is that we want to see more healthcare professionals, right, coming in as healthcare innovators who have the solid experience as professionals and innovators, and also ensuring that the patient is also in the picture, which is very, very important. Yeah, so thank you so much, Prof. It really shows that Prof has a very extensive background and understanding about digital health. Yeah, our time is fast spent now. We can't take any more questions. So we will be bringing the meeting to an end in about 5 minutes time. So yeah, so the purpose of this meeting is just to have the records on ground, so that we can we can prepare them later on for people to watch, people to learn from, people to also ask their questions, which will be answered on our website and going forward. Yeah, so I want to really appreciate everybody for joining. Thank you for this 1 hour and almost 30 minutes of your time this weekend. Our next webinar will be in May, because we have 1 month space before we have the next webinar, and this webinar is being recorded. We're going to process it, and then we're going to publish it online. So you can follow us on social media, subscribe to our newsletter, and also to remind you that for those who have registered, we are very happy to say that we're going to pick one person and offer them a free access to one of Dr. Oluwadamilare's courses on Gnosiscope for free. Yeah, that's going to be for one person. We're going to pick one participant who registered and offer them a free entrance into one of his courses on Gnosiscope. Yeah, so thank you so much for joining. We really appreciate your time. Thank you, Dr. Raphael, for coming in such a short notice and also contributing. So we're going to bring the meeting to a close now. If you have any questions, you can just send them to us. We will send them directly to Dr. Oluwadamilare to answer them. And if you have any concerns, you can just send them to the WhatsApp page that we created. Recordings and whatever, and all, and the slide too will also be sent to your emails, your registered guys, for those who registered. Yeah, thank you so much, and do have a very wonderful weekend.